Sweden's universal public healthcare system provides better results than Canada's. Long wait times used to be more common in Sweden, just like you might find in Canada today. But then Sweden made some changes. So how did they shorten their wait times? Well, I just got back from Sweden where I learned about 3 big differences between their public healthcare system and ours. Like Canada, Sweden has a universal healthcare system. Everyone is covered. However, they do a much better job of providing services to patients. A 2021 report by the Progressive Commonwealth Fund found that despite spending about the same amount of money on healthcare, Sweden's system performed considerably better than Canada's. But it wasn't always this way. For many years, Swedish patients suffered from long wait times. They had few choices when it came to healthcare services. They basically had a government healthcare monopoly. Spent a lot of money, but they didn't get very good results. In the 1990s, everything started to change in Sweden. The government opened up the public healthcare system and they began partnering with private clinics throughout the entire system. They would pay these private clinics to provide healthcare services to patients in the public system. This is the first big difference with Canada. While some Canadian politicians and special interest groups fearmonger about privatization, Sweden sees the private sector as a vital partner. After reforms were passed, Swedish patients could begin to choose between, say, getting their knee surgery in a government hospital or at a private clinic. In both scenarios, the government pays almost the entire bill for these services using tax dollars. Swedish patients do pay small user fees for health services. For example, in 2021, a Swedish patient would spend about $12 to spend the night in a Swedish hospital. Now, the government also has a cap so the patients don't end up spending too much, and the cap is at about $150 per year.
It has been a quite large change for maybe 10, 15 years ago when we opened up the healthcare system for choice.
Gustav Droge is the chairman of a Swedish think tank called Synapse. He has been involved in healthcare reform since 2010.
Before this, it would be just one provider with, you probably didn't know the name of the doctor, like just show up at this facility at this time and you will be taken care of. And maybe you showed up and there wasn't any time for you, or you had to wait like 12 months just to get a hip surgery. It was lacking in quality in time. You had to wait for your healthcare. It was lacking in quality in the actual like surgeon's quality of the treatment.
Droge noted that in Sweden there's a competitive market within a public system. Put simply, government hospitals and private clinics compete to provide patients with the best care possible. This leads to higher patient satisfaction and lower costs.
Patient use the primary to choose maybe the doctor that is closest to you, but it's also to be able to choose away from something, like the possibility to leave a bad doctor or a bad specialist doctor if they mistreat you, don't treat you well, or you don't get a time. Like they say, we can treat you in 6 months. And then you can say, well, thank you, but I'll try with the next guy.
We're starting to see more of this in Canada. For example, in Saskatchewan, patients have had the choice for several years when it comes to where they can get surgeries like a knee operation. They might choose between a government hospital or a private clinic. In both scenarios, when their surgery is done, they don't pay a bill. It's funded by the government through tax dollars. While provinces like Saskatchewan, BC, Alberta, Quebec, and others are doing this, it's not as widespread as it is in Sweden. Other provinces, such as Ontario, are now starting to partner more and more with private clinics. Despite the evidence that it can actually help patients, some unions and union-funded activists are fear-mongering about the changes.
We strongly feel that this will not benefit anyone but the corporations that are putting these clinics into practice.
We need to keep our healthcare system public.
Their claims are unfounded. The Commonwealth Fund's most recent report on wait times found that Swedes were far less likely than Canadians to have to wait long periods to see a specialist or to receive surgery.
Because the big thing is that is a good thing. is that it is public financed. I mean, if you go to a private doctor, the money follows you.
Gunnar Hökmark is a former member of parliament with Sweden's moderate party. He also told us that by giving Swedish patients more choice, their wait times came down.
It is not that the municipality or the public sector says either you go with us or not. It is opening up in that sense. But much more could be done, and there are differences in different parts of Sweden. And where you have had a policy for a long time opening up for the alternatives, you tend to have much shorter queues and waiting lists. Surprise, surprise.
Sweden doesn't just have private clinics. They also have privately run hospitals that are funded by their public system. So if you're a Swedish patient and walk into the hospital's emergency room for treatment, or maybe you're there for a scheduled hip operation, it's just like visiting a government-run hospital. Patients still pay the same small user fees either way. There's no big bill at the end. We spoke with Gustaf Storm, the CEO of Capio St. Goran, a privately run hospital in Stockholm.
So it's publicly funded, but it's privately operated by Capio, the company that I work with, who's part of Ramsay Santé Group, based in Paris.
Storm told us that while the level of care that they provide is about the same or better than local government-run hospitals, their costs are significantly lower.
So at the beginning of this tender, or the agreement that we're currently in, the year 10 that we're currently in the agreement, in the beginning the price difference was about 10%, 10-0, but we see now that there's been a growing gap. So it's almost 30%, 30 difference in price for the government to buy care here, 30% cheaper than to have it in their own facilities.
This privately run hospital in Sweden has actually been widely praised by The Economist magazine, the UK government, the Montreal Economic Institute, and others. In fact, there's a government-run hospital about 4 kilometers away that costs more to provide the same procedures, and yet the quality is about the same level. A second clear difference between Sweden's healthcare system and Canada's is accountability. Sweden's system has a guarantee for its patients. If they can't see a specialist within 3 months, then their health region has to pay for the patient to go to another health region to receive the service. This rule also applies if a patient doesn't receive surgery within 3 months. Again, the patient gets to travel somewhere else in Sweden to receive the procedure. This guarantee helps ensure that Swedes receive surgery within 6 months, unlike in Canada, where sometimes the government will string patients along for sometimes years.
7 years, can you imagine? 2 more just to see the specialist?
9, 18 months, 2 years. I've heard worse stories than that even.
When they told me I would have to wait 2 to 3 years to get into the public system for sinus surgery, I was utterly demoralized.
We have some stories here from Canada where people have to wait often long periods, and the results can be quite sad. We have a case where a young patient had to wait 27 months for surgery. He ended up paralyzed permanently, young boy. This couple, they ended up going to court because they were waiting 4 years for hip surgery in New Brunswick. This lady in Regina, she considered applying for assisted death because she was having to wait so long for surgery. Is that acceptable? Like, would people in Sweden find these types of stories acceptable, or would you end up with some kind of change happening?
No, I wouldn't say that like we've heard those kind of stories here.
What are long wait times that you've heard of in Sweden?
From what I read on the news, it can take like a month or so.
So in Sweden, if I cough and like I have a chest pain, I'm nervous, I feel ill, then I call a number, which is a nationwide number, and I ask, like, I feel sick, what should I do? That's like a first triage, like some kind of priority, and they say, well, you should go to your GP, general practitioner, like healthcare provider, and then I have 3 days to get medically examined by a healthcare professional. And it's Saturday or Sunday, it doesn't matter, like 3 days, 72 hours. And then after that, and they say, well, you need to go to a specialist. You need to check your chest. Then they have 90 days to grant me a visit to the healthcare specialist. and then often a lot faster. But there's 90 days, and then they have additional 90 days to actually fix my chest. So in all, on the worst day, you have 6 months, and then you're still within the guarantee.
Dr. Johan Styrud is the president of the Stockholm division of the Swedish Medical Association.
The system here in Stockholm says that you should perform an operation in 90 days. If you will make an MR and you will do it in my hospital, you have to wait quite a lot of things. But we have here in Stockholm quite a lot of private MRI.
Okay.
So that is quite short waiting list.
Okay. How long will it take you?
2-3 weeks.
The third major difference with Sweden's healthcare system is that patients aren't forced to use the public healthcare system. They're allowed to also purchase private health insurance. So if a patient is looking at, say, a total of 6 months to meet with a specialist and then receive surgery in the public system, they have the option of paying for surgery at a completely private clinic and receiving care faster. While most Swedes use the public system, about 7% of the population has decided to pay for private insurance.
Everybody's just paying for the big system, but then they're paying extra just to be outside it, and they're taking pressure off the big system.
This is quite different from Canada, where there are many barriers between patients and private healthcare. Quebec patients can go to private clinics in Quebec and pay for surgery. However, patients in the rest of the country don't have that same right. They're not allowed to pay for local surgery in private clinics. They must travel to other provinces or other countries for surgery. This is why, for example, a Calgarian will travel to Vancouver for knee surgery, and a Vancouverite will travel to Calgary for that same type of knee surgery. Dr. Brian Day is a surgeon at a private clinic in Vancouver.
I was here operating on 3 Alberta patients, and a colleague in Alberta was simultaneously operating on 3 British Columbia patients. That's how nonsensical this rule and these laws are.
In Sweden, they don't have these barriers. As Gustav Droge noted, this helps take pressure off of their public healthcare system. One interesting observation about our discussions with Swedes about their healthcare system is that many conceded it isn't perfect. They too are having problems recruiting and retaining staff. They're also having challenges because of COVID increasing wait times. However, it's clear that Canada can learn a lot from Sweden's healthcare system, particularly how they use choice and competition to improve access to healthcare services for patients.
Don't be scared that you can make your own choice. Don't be scared that you can go somewhere where you can get healthcare instead of queuing. Don't be scared of medical and private alternatives offering better services. Don't be scared about private institutions that are having a higher level of satisfied and happy people working there. Don't be scared of going somewhere where you can require what is to be done and when. Don't be scared of not standing in a queue.